point in the presentation, I'd like to just address the idea that your patients are sometimes going to die with this. I just want to make it abundantly clear to healthcare workers that they should not feel personally responsible for the deaths of these patients. Just know that many of these patients who develop severe sequelae of this disease will die, and there's absolutely nothing we can do about it. Patient deaths are not a sign that you didn't do enough or that your care was in any way deficient, but this disease causes an unusually lethal combination of severe syndromes that alone are difficult to survive. Most patients with HLH honestly die, and most patients with DIC also die. We have a disease that is causing both of these syndromes together often. So just keep in mind that what you're dealing with is really kind of a larger than life, extremely high mortality syndromes, and these syndromes usually don't cause uncomfortable or easy deaths either. So if you do see patients that die, just know that this is not something that you caused or something that you contributed to in any way. It's just that you're dealing with something bigger than what we can realistically handle. For what it's worth, again, I've never actually seen HLH prior to COVID-19 in my 13 years of emergency medicine, and I've only seen DIC twice before. The best outcome of those two people was somebody who survived with some degree of multi-organ damage without complete organ failure, and she lost all 4 of her limbs. So you're really dealing with some pretty severe sequela of this disease. Just keep that in mind if you do have patients that do die or do abruptly deteriorate, and you may not necessarily know what happened to them. So we're really dealing with some pretty severe, difficult to handle consequences of this disease.